Emergency service providers work 24 hours a day, 7 days a week.
Our main purpose is to save lives.
That's what we train to do.
Somebody dies or somebody gets saved.
For our first responders, the moment the call for help comes in,
4 people in the water from a sunken vessel.
the race against time to save a life begins.
How sick is this patient?
It is a life and death situation.
Through unprecedented access
His body's starting to shut down.
We need to do something quickly.
It is going to be painful.
and intimate interviews,
It'll certainly stick with me.
in this series, we're telling their stories.
It is a privilege to be able to help people. It's not something I ever take for granted either.
To change a patient's outcome feels amazing.
G'day.
This week on First Responders.
Stop.
A severely broken leg means Matua is taking a shortcut off the side of a mountain.
No way. Are we actually going up?
We'll try, eh?
A cardiac patient takes a terrifying turn.
Dawn, can you open your eyes?
And a runaway tractor accident with a patient who can still see the funny side.
Is it worse when you move?
Well, I haven't moved.
Okay.
Nelson's mountains are home to all manner of outdoor sports, and inevitably things sometimes go wrong.
So off to a 13-year-old who's fallen off his mountain bike just up here in the hills behind Nelson with a lower leg injury by the sound of things. So we'll go and see what we can find.
So our mission is up in the Mount Richmond Ranges, the mountain bike tracks up there. And that poses a few issues for us because it's so close in terms of only having a 2 to 3 minute flight time. We're very heavy because we've got a lot of fuel on board and bits and pieces, and then trying to logistically find these people in amongst the tracks and trees that surround us. When we have something that's potentially or is a known winch job, we'll start reconfiguring the aircraft. So we'll pull the striker out, we can pull the bottom of the seats out, we can take some gear that we don't necessarily need out. And the reason for doing that is firstly to give us a bit more room in the cabin, so we've got room to work and get the patients in and out through the door. And also it lightens the aircraft significantly as well.
Oh, we're back, gentlemen. Yep, all set.
Hotel Golf Whiskey, take off your discretion, clear to the east of Richmond, 2,000 feet or below, caution paragliders.
Okay, Hotel Golf Whiskey.
It's just some job notes, trees all around the patient. One child has gone to the nearest clearance to raise help also, about 4 corners down from the top of the terminus track.
If you look down to your one climb through the grassed area that's quite on the side of the trees, like a picnic table there, we can land there if need be.
Down
just,
here?
Just coming down low, yeah.
Oh, yeah.
Pretty sure I saw someone standing here. Yep, got over there, 3 o'clock waving to us.
Okay.
Front door's open.
Just wave him off so we don't blast him.
Yep, he's moving across around 3 o'clock into the trees. You clear to descend on the right. Keep an eye on that left side, button, see there's no one there. And your dust blowing forward now.
Yeah.
We overfly the area and we can't locate the patient from the air, so we've landed on a skid site up there to have a chat with a young lad that's there.
How you going?
What?
How you going?
Good.
Good. So we just need to know where these guys are and roughly how far.
They're down there, River.
He's a friend of the patient and he tells us the patient's down a track. He's a little bit vague on just how far down the track is, and he tells us that we can probably find him about 100 metres from where we've landed.
Oh, you guys just sit back, relax, and I'll give you a yodel shortly. Okay.
It turned out to be a little bit more than 100 metres, probably 500 metres, maybe a little bit more than that. It's hard to judge when you're a young lad walking up a hill just how far you've walked.
Hello, pup. G'day. I'm all right. How you guys doing? Hey, pup. Box of fluffies? G'day, buddy. My name's Barney. What's your name?
Matua.
Matua. What's happened, Matua? You fell off your bike, yeah? Okay.
Once we managed to locate Matua, he is with a bunch of adults and with his mates and with a dog. He's, I think, a bit anxious about just what's happening, what's going on and how things are going to play out for him.
So you're coming down here, obviously. What caused you to come off, do you think?
Missed the brakes.
Missed the brakes?
I went over the bars.
Over the bars.
I was going down and I lost my hands on the bars and then it fell off. It was like a big drop as well. I started screaming to my mates.
Either of you a parent? No? Do your parents know what's happened? Yeah?
They're at the bottom of the hill. They were going to meet him at the hospital.
Sweet.
I was wanting to make that run up the hill. Then we heard the chopper and we thought, OK, he's in good hands. Scary knowing that a chopper's hovering above, about to pick up your son, not knowing actually how bad he was or being able to see him, but luckily he had a mobile with him, so it gave us a wee bit of relief.
I'm going to have a look at your sore ankle now. I'll be as careful as I can. Just going to take your sock off really carefully.
Do you think it's broken?
I think it probably is, yeah. Cool, man. You been in a helicopter before?
No.
Plan will be stick a little needle in, take it out, leave a little plastic tube.
So I stick a IV line in and give him some strong pain relief.
Cool, mate. I'll give you that arm back for a second. You can still bend that arm, should still be able to use it as normal.
Barney gave me some, I think it started with P. And then after that, I started feeling better.
Can we stop and get some Macca's?
Get some Macca's. We don't fit through the drive-through. We've tried. It didn't go real good. Had to get a new helicopter.
He's in a bit of a strange situation. He's injured his leg. He's reasonably sore. He's reasonably anxious. So I try and bust out some of my worst humour to try and keep the situation cool and you reassure him that we're going to take good care of him.
I forgot your name.
I'll give you a clue. There's a very well-known purple dinosaur with the same name. Yeah, boom, you got it.
I love it.
I've got 2 young girls, so there's plenty of dad jokes. A bit of humour, I think, always helps. Bit of distraction from what's going on.
Cool, man. Get my fancy splint out. It might look like cardboard, but it's actually cardboard.
And then we pop his leg into a splint, and that's to keep it still and stop the movement, so that'll help to reduce the pain and, yeah, keep it stable.
Stop.
Can you straighten this knee up?
He was reasonably sore through that. The approach working in the helicopter is a bit different to if we're on the side of the road with an ambulance. Because we're in the hills, I don't really want to sedate someone before we winch them out because you never quite know how that's going to go. So, yeah, we give them some good pain relief as best we can. Once it's in the splint, it should be nice and solid and still, and that'll help with the pain.
Doing really good, Matua.
You know my name?
Yeah, I remember your name, but you can't remember mine. So we're buddies.
Obviously, we need to work about the end goal, which is to get him out of the bush. We need to make sure that he's comfortable and we need to manage his injury. So I set about working out the final step, which is how we're going to get out of there, because I need to talk to the helicopter and make sure they're on board and they can prepare for that.
We're going to get out of here real soon, man. I'm just going to shoot over to that hole in the ground, set up the nappy, and then I'll be back and we'll be going. Oh, because it looks like a big nappy.
So, yeah, really important to build a relationship with the patient, especially in the setting we were in. I need to convince him that the care I'm providing is the right thing for him. I also need to convince him that we can strap him into a harness in a really strange situation and stick him on the bottom of a cable and winch him 100 odd feet up into the air. If he doesn't trust me to do that, then it's not going to go very well. So really important to build that relationship with the patient, and quickly.
1, 2, 3.
I'm a pretty heavy baby.
Get just up into that hollow behind the tree.
Stop.
Can you straighten this knee up?
A 13-year-old mountain biker who's badly broken his lower leg needs to be winched to safety from the Mount Richmond Ranges by the Nelson GCH Aviation Helicopter Team.
1, 2, 3.
I'm a pretty heavy baby.
Get just up into that hollow behind the tree. Man, don't have breakfast next time, eh?
Didn't actually have breakfast.
Oh. Are we able to lower this down really slowly and gently?
Where's that bag being hit?
It's over there, but ideally I don't want to put it under your leg because I need to attach it to us to go up.
No way. Are we actually going up?
We'll try, eh? Hey, mate. We're all ready to go, so I'll chuck my helmet on, I'll chuck the radio on, and I'm guessing it's going to be a bit of talking. Now, we are in a whole stand of pine trees, and one... It's a big enough hole for you guys, it's a big enough hole for me, I'm happy with it.
Okay, if that's our best option, we'll deal with it.
From the educated eye, it was pretty dense and a lot of pine trees. The problem we've got with that is trying to locate these people, even when our medics are on the ground. Now, they're wearing bright red and a white helmet, and you would think, well, surely, how blind would you have to be not to see it? They just blend in. And you only need to be on a slightly wrong angle, and a shrub or a bush or a tree will obscure them. And we can be right over the top of people, and they'll go, you're over us, and we just literally can't see them because of the angle or because of where we are.
I haven't seen it as yet. Roger. It's good line, you're almost overhead. A little further, and you should see it. He says we're overhead there. I'm sure we are, but I haven't identified yet.
Looking downwards from the top, for a lot of people who have never done it, it is tight, and then there's inherent risk because it is so tight, but that's what we're trained to do, and that's the realism of what we have to do.
Clear skids. Clear skids. And I'll take off the hand as well.
So there's risk for a start-off to the aircraft of myself winch operating with the pilot, so I have to verbally position him because he can't see directly below him.
Forward clear winch. Clear winch. 1, steady forward.
I put the cable out, and I have to be very aware of where that cable is going in terms of any drift, whether it's going to entangle on branches on the way into the canopy. We're also pumping down about 40 knots of rotor wash down through those trees.
It was like real windy, and I was like, oh, I don't want to do this.
Going back 1 and up. Okay. Steady back. Good position.
It's your safe as, bro. You and me together, we're good. Point of view, eh?
You have to wait, steady up over 3 holes. Clear the winch. Clear the winch.
Once they've connected and they're ready to be winched back in, the danger then is again for myself and the pilot to be able to pull them safely and keep them in that area and judge what we're doing and move the aircraft if we need to keep them coming up through that hole nice and smoothly the whole way.
Back 1. Back 1.
When we got there, it was scary because I didn't want to get like chopped up by the planes. And Barney said that when someone goes to grab my arm, not to pull them out. And I was like, wait, no, but I might accidentally pull them out. And he was like, no, you'll be fine. And then, well, yeah, it was scary.
Mantua coped surprisingly well. He's in it, he's doing it. He hasn't got much choice but to hold on and smile. Always tell people to enjoy the view. It's not often you get to hang above the trees in a harness like that.
I'll take winch power off on the climate side. Roger. Cleared move away slowly. All 3 are on board. Winch power's off. Roger. Well done, mate.
I am concerned about the injury he's got. He's got a pretty significant injury to his lower leg. He's clearly fractured it, and his foot has some level of compromise, so the hospital team need to be getting onto it pretty quickly.
Cleared to hospital 1,500 feet below full landing. Full landing, cleared hospital 1,500 feet below Hotel Golf Whiskey.
So we headed off to the hospital, and we waited and we waited and we waited, and then we got the call that the helicopter's on its way now.
Hotel Golf Whiskey finals the hospital. Have your wheelchair on it? Yeah. All clear, Colby? Yeah, mate, thanks.
Barney brought me into the hospital, and Mum and Dad came in, and Dad started sharing some tears. So then I started sharing some tears as well, and then we all like had hugs and stuff. Yeah.
It's hard seeing them in that state, but I looked at Barney straight away and seen what he was like and reacted off that, and I could see he was pretty calm, so that kept me pretty calm, to be fair. He was so good with them, amazing. So he'd broken his tibia and fibius, I think it is, so your front and rear above your ankle. Then lots of drugs, lots of leg straightening, and then I sort of stayed by his side for the next 3 days. He got surgery, he got 4 screws put in his leg, but he healed really fast. 8 weeks later, he was playing basketball again, so it was fantastic. Young boys heal well. Well, the surgeon was super stoked with his recovery. Full steam ahead till the next injury, yeah.
So we've got someone with chest pain who is in and out of consciousness. We're going to pop down and see what's going on. Ambulance will be on scene, so we'll have a look and see what they've done when we arrive.
It's a considerable distance to the patient John, and there's no time to lose. John has a history of serious heart issues. He's had to be resuscitated 3 times before, including once by the GCH aviation crew. But in Scott, John will find himself in extremely experienced hands.
I was quite young. I was 19. I was studying to be an economics and accounting teacher and found I was picking up medical books more. So I was told if I became a volunteer in the local area, the first aid course was free. So I thought that sounded like a great plan. And then as time went on, I quite enjoyed it and decided this was quite a good career. We get the privilege of stepping into people's lives when they're most vulnerable. It can be the richest of houses and the poorest.
And as he readies himself to help John, Scott is yet to discover how hands-on he'll have to get.
It can be based on the sickness of a patient, but it can also be based upon the best possible destination for this patient's condition. We can be deployed for more a transport reason than the sickness of a patient.
John's a caretaker and was at work when he started feeling ill. With 8 stents in his heart, he was quick to seek help.
Hello. My name's Scott. Hi, John. Yep.
12 arteries is going to have a syncope.
Yep.
Climb down the ladder, sit on the ground.
About what time?
8:45.
Okay. The patient has experienced some collapse episodes, or syncopes as we call them, and at this stage we're looking at someone who's had a bit of chest pain and who has had some episodes of collapses.
He described this and felt like his blood pressure was going wrong.
Yep. How are you feeling?
Yeah, not too bad, but I don't feel right.
You don't feel right. In what way don't you feel right?
It's just feel crap.
Most collapse events are often associated with what we call dysrhythmias, or abnormal rhythms of the heart. They're not sure why he has had these collapses. He's done multiple ECGs, which are maps of the heart, and there's nothing jumping out on those to signify that he's having a heart attack. That's very high on our list of causes for collapses. There are a lot of different causes, and we must work through them. Have you been well lately? Any coughs or colds?
No, I haven't had anything, no.
Alrighty. Have you still got discomfort at the moment?
Just a wee bit.
Take a deep breath for me. He's got quite a significant cardiac history. He's had some stenting done, which implies that he's had some blockages within his heart. Everything we're pretty much doing, John, is around your previous history a little bit. Until proved otherwise, we'll sort of assume it's your heart a little bit, but it may not be. When we first look at a patient, we can glean whether they are quite sick or not. His colour wasn't too bad. He was maintaining his vital signs, his blood pressure. His heart rate at the time was slow. He's medicated for it to be slow to manage his blood pressure. So for all intents and purposes, he presented well. So on the way up, don't hide anything. Let me know if anything changes so we can keep ahead of you there. If that pain worsens, let me know and we can top you up with some pain relief. Just if anything changes in any way, shape or form. All right, we're on. Helicopters are very confined areas. I like to lift off the ground with fluids attached, if not running. Nasoprongs in place, which are just an oxygen delivering device. Again, just squared away. And then if the patient does have either an event or a certain response or a side effect to a drug that I give, then we're set up ready to go, and all I need to do then is just reach over and turn things on rather than having to attach things and take longer to do things.
It's preparation that's well-founded, for soon after takeoff, John takes a turn for the worse.
So we've got fluids, we've got oxygen.
John has a history of serious heart issues, and after taking a bad turn today, the GCH aviation team are transporting him to Christchurch Hospital.
I'll switch you up again, John. You say when that's comfortable for you. We'll just keep an eye on your heart rate. It's a little on the slow side. I don't know what's normal for you. All right. I'm going to put some headphones on you. You'll be on comms with us, so... And very shortly, I'm going to do one of those ECGs we talked about, okay?
Okay. Yeah.
All right.
How's the pain in your chest? It's gone back up again. All right, I'll top you up, eh?
So with all medications, we tend to balance risk versus benefit. Chest pain increases heart rate, increases anxiety, so we try and manage that from a decreasing the workload of the heart type thing. He has no history of being super sensitive to opiates that I'm aware of. So I gave him 20 micrograms, which is a pretty standard dose. Shortly after that, he became unconscious.
John? John?
Whenever we give medication, we should always be acutely aware of the side effects and be prepared to manage them. So it's no big surprise if someone does experience side effects such as nausea or, in this case, a collapse.
John?
Whenever someone has an acute change like that, we start back at the beginning, at the life-saving stuff. Has he got an airway? Is he still breathing? And how's his perfusion status, which is the blood getting to where it needs to get to. In his case, he was maintaining his own airway still. He wasn't sitting there snoring. He was still breathing by himself with a good ventilatory effort. And he still had reasonably good pulses and reasonably good blood pressure.
He hasn't thrown any dysrhythmias. His blood pressure's still 120/86.
I was happy with all his life-preserving functions. He'd come back in his own good time.
He's quite sensitive to the old fentanyl. John, can you open your eyes? Open your eyes, John. Yeah, sir. Hello. How are you feeling? You had another period of unconsciousness, mate. All right? All right. I've also given you a drug just to speed your heart.
For this individual, it's an acute event and can have dramatic changes to their life, their family, their job, etc. If we forget that, if we just there to give medicines, then we've missed the whole joy of the job. That is being quite human to a person and quite supportive of a person. You treat people like you'd like your family to be treated.
Not too much longer now, John. All right. Do you have any questions?
Once his heart rate sped up a bit, he came back to a level of consciousness where fully interactive and normal for him. No chest pain, just really feeling washed out, and that's it. So he was back to what he was in the ambulance, essentially. Experiencing chest pain, which can quite often be written off as indigestion or something very minor. Humans are notorious for putting their head in the sand and writing stuff off. It's better to seek help and have it ruled out than to not seek it and suffer sort of more severe consequences as a result of not getting that early intervention.
Doctors confirm John had suffered a heart attack and he's now well on the road to recovery. For first responders all around New Zealand, farm accidents involving vehicles make up a huge number of their call-outs. They're never taken lightly because often the outcome is fatal. Today, the Auckland Rescue Helicopter team are heading to one with limited information.
We had a call to say there's been a tractor rollover in Colville, which is in the Coromandel, and that's what we get. There's the mental preparation, which is different every case. So how sick is this patient? Are we going to someone who's very close to death?
Yeah, Westpac 15 to Westpac hangar, and we'll be going via the waterworks.
So what can be the worst thing here, and what do I need to prepare for? Am I dealing with someone who's going to be bleeding. There's going to be a lot of blood loss here, or internal blood loss, and I need to get ready to give a blood transfusion. If he's trapped, how long is it until we can get him out? Or who's helping? Who else is going to be on the scene?
So we'll do the normal kind of scene safety and just go completely broad, phones off, oxygen, monitor it, IV access, and then we'll assess the scene. We'll keep checking in with each other to see where we're at.
Yeah.
Latest page is patient not trapped, older style tractor with no cage rolled over.
My primary role is usually a co-pilot. It's either flying the helicopter or assisting the captain with radio work, navigational stuff.
Happy if I get out of the seatbelt onto the safety strap?
Yep. You just don't know will we be able to land there. Then my role becomes a crewman in the back where we winch paramedics down on the wire. I always wanted to fly. Sort of flying is in the blood. My dad flew in the Air Force, so I grew up around the aircraft. When I was 19, I was involved in a vehicle accident. I had a head-on collision with a drunk driver and sustained multiple injuries. I got flown by a life flight from Blenheim to Wellington and had multiple surgeries. And as I was in the back of the aircraft, that's where it all kind of kicked off. I was just like, this is exactly what I want to do.
Yeah, follow the road, buddy, to the right.
I guess it was kind of like a way of repaying for all the things that have been done for me. I just want to do the same for somebody else. It's incredibly rewarding. It's a dream come true for me.
Yeah, I got the ambulance down there with the pole. Oh, yep.
Most farm accidents we go to big paddocks. Not this time around. We arrived overhead, looked at the scene.
Yeah, wise, and it's the construction site, so I'm guessing a lot of the dust we're going to get pick all of that up.
The paddock was very small and there was a lot of construction gear. If we attempted to land there, we're just going to create so much havoc with our downwash. We're going to do more harm than good.
Not happy with it. I got a lot of tall poles around the concrete pad.
With the patient's status unknown, the team needs to find a safe landing spot, and fast.
Yeah, wise, and it's the construction site, so I'm guessing a lot of the dust we're going to get pick all of that up.
The Auckland Rescue Helicopter team are on their way to help a Colville man who's had an accident on his tractor. With his status unclear, the crew need to quickly find a safe landing spot.
Not happy with it. I got a lot of tall poles around the concrete pad.
Thankfully, there was a nice paddock and a small airstrip just down the road.
Colville Brigade to rescue helicopter, receiving over.
Yes, hello, Colville Brigade. We are going to be landing at the airstrip, which is about 200 meters away from you. There is a road access, so the ambulance can drive there. It's just the best location for us. Copy?
Copy that.
I do enjoy opening the door because, especially when you fly around the Coromandel, you get hit with this amazing New Zealand scenery. It's quite a special place, really.
Yep. No signs of wires, just got a fun fence on the left.
But then you try to concentrate, hey, I got a job to do, actually. Enough of looking around.
Nose wheel 1 foot above, and left wheel is touching. Brakes on. Guys can leg it.
Thanks, guys. Cheers.
Because we were about 500 meters away from the scene itself, we had a fire truck come and kindly take us to the scene.
Hey guys, thanks for picking us up.
And they drove us closer to the scene.
Thank you, mate.
So as we walked down, I could see David was talking to several people, and already it was quite reassuring that he was talking.
Hey.
And I could see there was nothing on top of him either, and he was lying on his back with his knees up and didn't look like he was in too much discomfort in that position. So that made me feel like I can afford to get a handover from the guys who were with him at the time.
So the mechanism of injury is slightly different between David and his wife.
Okay.
His wife observed
Hello.
it, but
Hi.
on this tractor,
Yeah.
and it started to roll.
Yeah.
David reports that he jumped clear and it hit him on the back of the back hip pelvis on the right, and that's where he's sore at the moment, and he's saying 4 out of 10 pain, but he is holding his position with his legs to keep himself comfortable.
Okay.
He isn't happy for us to move his legs, but he doesn't have any loss of power or sensation at the moment.
Okay, yeah.
Cheryl felt that he rolled once with it before he jumped off.
And you saw this happen, did you, Cheryl? You were just over there.
There was 2 slightly different stories as to what happened, and I could see a tractor was just a little bit further on down the hill. He was quite far from it. So it does kind of change a little bit in terms of how I think, because a rollover and then an ejection would be a slightly higher risk of internal injuries than simply jumping out of a tractor that's losing control down a hill.
He just hates fuss. He doesn't like being...
You hate fuss? Oh, this isn't fuss. You've only got about 3 fire trucks, about 2 ambulances and a helicopter. That's not fuss, is it?
The fact that he's talking to me and in humour and actually breaking down those barriers and having a little joke with him, I think puts everyone at ease.
Is it worse when you move?
Well, I haven't moved.
OK. And you don't think you got knocked out or anything like that?
No.
No.
My concerns would be any internal bleeding. This is why we check his blood pressure, his pulse rate. These give us clues to whether he's bleeding from somewhere.
The heart rate and your blood pressure are reassuring, but it's a pretty significant mechanism that's happened there.
The fact that he's potentially been ejected out of a tractor at speed makes me think that there is potential for internal injuries, and that'd be the life-threatening ones, and that'd be the ones that I would need to worry about. And often patients can look really well, but then when you do move them, or even with time, they can then decompensate, and their blood pressure can go down, their heart rate can go up, and this is often due to internal bleeding.
No pain in your chest wall there? Good.
Our priority would be to move him from that area.
We'll need to take you to hospital so they can do some scans, OK?
The best way would be to move him was to put him on our scoop stretcher, which is quite a nifty bit of kit, and it's quite quick and easy to do.
On 3, 1, 2, 3.
Fantastic. Thank you.
Run my hand down his backbone just to rule out any injury to the vertebra, to the backbone.
Any pain here? Here?
Yeah.
There? OK, cool.
There's certain areas where he was tender, so that was good for me just to make a mental note of.
Right, now that bit's done, we're going to put the board behind you now, OK?
Then just very little, minimal movement, we're able to get him onto a scoop stretcher.
We're going down on 3, 1, 2, 3. Over we go.
Nice and smooth, nice and smooth. Hey, awesome.
How you going, boss? I've been better days, yeah.
The patient arrived to the helicopter by ambulance, so I just started getting the stretcher ready, setting up the cabin. Wouldn't say I enjoy seeing people in those situations, but at the same time it's very nice to be there when the person needs your help.
Thank you. Got it.
That's the part of the job that I think I enjoy probably the most.
And let's lift it up a touch.
I remember how it feels myself being on the other side of the stretcher.
We'll give you a few earmuffs also because it's going to get quite noisy. If you need to chat to one of those guys, just wave your arm. All right, cool, no problem.
I know it is just a mixture of emotions for the patient. It's everything from gratitude to embarrassment to happiness and sadness. It's very rewarding for all of us, I think, when we actually able to help those people.
David was extremely lucky in this situation. We've had experiences like this where the patient hasn't been in a good state.
There's a big tractor from what I hear.
Yeah, yeah. One of those older ones, though.
Yeah. Lucky, eh?
We give them Waikato Emergencies Department a pre-alert whilst we're in the air so they can prepare.
We're coming with a 58-year-old male currently travelling status 3, TCS 15. Chief complaint today is lower back pain after a tractor rollover on a farm. Currently all his observations are within normal limits and we're in your department in 10 to 15 minutes.
Satisfaction for me is leaving the patient with a smile despite the pain and the trauma they've gone through.
Clear door push.
Yeah, thanks team.
They're happy that you've got them somewhere safe, and he was quite a stoical guy, David.
Thanks. Hey, all good.
And he kept on saying he didn't like the fuss, but then he was telling me about he wants to get back and start, finish off his house. And I think gaining that rapport and making him almost forget about the trauma that he's gone through is really powerful.
All right, no problem. Yeah, see you guys later.
When you see somebody in pain or in their most vulnerable moment and you had a chance to kind of support them, help them through those things, there's just nothing better than that, really. So, yeah.
An urgent call for help from an injured tramper has just come into the Nelson GCH aviation team.
Fridge, you go up here in the Richmond Ranges somewhere.
Oh, yeah.
Usually coordinates.
Cool.
Put them in mind as well.
Which job is it?
He's not sure.
St John critical care paramedic Rob Clark and pilot Brendan Hyatt don't have a lot of information, so they're heading into the Richmond Ranges prepared for anything.
Tower from Hotel Golf Whiskey. We're at the northern hangar's got 3 on board. We'd like to lift from here, and we'll be vacating sort of out more towards paraponting area there, over into the Richmond Range.
Problems from E1 Nelson.
E1 Nelson, go ahead.
Yeah, good afternoon. We have 3 POB with an ETA of about 10 minutes. Fuel was 2 hours.
Copy, understood.
The team have GPS coordinates, but the area is heavily forested, and until they get closer, they can't be sure how they'll be rescuing the tramper. One thing that is certain, walking out of the rugged terrain on a fractured ankle would be almost impossible.
So we've just gone past those corners by the look of it. Yeah.
With thick bush obscuring their view, the team take a slow slide along the ridgeline,
Pretty dense and narrow.
which gives them the chance to spot an orange vest.
Thank you. Got them there now. There's a little clearing. Okay.
Brendan has clocked the group in a small slip, but it's very steep, and landing isn't an option, so Rob will be winched down.
So there's people up in the trees as well. Now that looks reasonably steep. Yeah.
Oh yeah, just down there.
The decision is made to use the ARV vest, or nappy winch, but there's a bit to prepare for. So the crew attempt to find somewhere they can stage.
Yeah, out to your left is up in there somewhere. It's called Fowler's Hut. Yeah, I don't think it's going to have a big clearing. No, we have to go somewhere else.
With their options limited, they prepare for the winch in the air.
Probably about 50 metres. Let's just find out where they are again. They're pretty much at the top of that slit-through the canopy. Yeah.
Happy with their location, the crew get underway with the tricky manoeuvre of winching Rob down to the small slip, covered by heavy canopy.
Yeah, I copy. Do you copy me?
Copy. Have you made contact with anyone yet or not?
Not yet. It's pretty steep, rugged terrain. I'll get back to you in a minute.
So once you do, we might just go and sit down for 10 minutes and then come back. I don't know how much time you'll require. But get us posted.
Yeah, we'll do. Thanks.
There's now no sign of anyone in the clearing.
Hello? Hello?
Brendan, do you copy? Have you found them?
No one yet, no.
We have gone to the wrong place, have we? No, because that was definitely that slip. Or is it the other slip there? You see we've got 2 slips. Did we put them in the wrong one?
The team soon realise that there are 2 virtually identical slips in close proximity to each other, and unfortunately, they've winched Rob into the wrong one.
Hey, Rob.
Yeah, go ahead.
You're in the wrong place. I'm sorry. We're going to have to whip you out of there.
Okay, no worries. Just give me a few minutes to get back. It's quite rough terrain.
Okay. Are you in the same place, or is there someone up higher we can get you?
I'm a bit higher. It's pretty dense bush, so I'll probably have to get back to where I was.
Okay. Yeah, we've got a very, very similar piece of terrain just down the ridgeline, so we've got that wrong, so I'm afraid.
Searching in dense bush is challenging on many levels, but the team work quickly to get Rob back on board, and they make their way to the target location.
There they go, right below us.
It's another delicate manoeuvre in extremely dense canopy.
Yeah, Brendan, do you copy?
Go ahead.
Yeah, all good here. I'll get back to you soon.
Just pass our apologies. It's a very similar landmark to where we went.
Yeah, no worries. It's going to be off comms for a few minutes. Hey, team. I'm Rob. Who's our patient? That's right. Apologies, we went to the wrong spot. It was an area that was quite similar. So, yeah. Right, what's happened?
I can't remember what happened, but...
Yeah.
Yeah, so around 11:30 we were travelling and doing some motor bike, and she tripped and fell, twisted, and snapped, but it was
Okay, her right angle?
Sarah, which ankle is that?
Left, okay.
Has good range of motion, like this, but heaps of tenderness when there's any pressure on it, and has put weight on it, but it's like a 9 out of 10.
9 out of 10. Okay. So what I'm thinking about doing is we just get you straight in the heli, and we can get you to hospital and get you sorted out. Is that all right? We need some of you guys' help because they've got lots of gear and it's a bit slopey. Yeah, Brendan, do you copy?
Okay.
Yeah, I'll prepare for an nappy winch. Give me about 10 minutes. Okay. So we're going to winch you up, Sarah, okay?
Yeah. The chopper is low on fuel, so Brendan heads off to find somewhere to land while Rob prepares Sarah for the winch.
Didn't hit her head and knock herself out. So pain?
It's okay when I'm just sitting down and I have had some pain relief.
Yep.
It's just when I put pressure.
It might be a bit sore when you get yourself into the helicopter, but it'll only be very short lasted.
Okay.
All right. All right, I might get you guys to head all the way back now.
Thank you so much.
Okay.
Bye. Bye-bye.
I'll see you in a bit.
See ya.
Thank you.
Bye.
And this.
So how do you do it? You just slip?
Yeah, it's so, like...
Yeah, it's pretty rough terrain, eh?
Yeah, and I just stepped on it and then I fully just fell and then kind of rolled down.
But it was
way further down, but they were like, oh, there's no way they'll be able to get you.
Yeah, so
I crawled up. It's called the slippery gut, and we had to... I had to climb up.
Where'd you fall?
Everyone was helping me. Maybe like half a K away from here.
Oh, yeah.
With Sarah fully secured in the harness, Brendan returns for the retrieval.
So just make sure that it's nice and high up. Yep, perfect. Yeah, Brendan, you copy?
Okay, go ahead.
We're all good for a nappy winch now.
Copy that. Are you going from the same
It's
place?
the same location you just put me in.
Yeah, I got you now.
The added weight of Sarah on the winch means extra risk, so the crew work with a great degree of precision and care to get into a safe position.
Hand.
Rob connects the winch hook to both he and Sarah, and the team begins the job of bringing them back on board.
Anyway, I'm just going to get a safety on here. Sorry, Sarah, we couldn't find you.
No, it's very dense.
Very, very hard to see through that canopy, eh? Got you in there. You all right?
Yeah, I'm all good. Thank you so much.
No worries, you did really good.
Comms, Air 1 Nelson.
Air 1 Nelson, go ahead.
Advising ETA 2 minutes to Nelson ED. We're coming with a 21-year-old female, status 4 patient with an injured ankle. ETA 2, can you just go to the pad?
Sarah was on a 3-day hike with Outward Bound, but the accident meant she could no longer walk. So they made the right decision calling for help.
Cool. Around there somewhere. Rightio, thank you. Cool.
Thanks, Brendan.
At Nelson Hospital, Sarah's injured ankle was treated and she was later able to rejoin her group and complete the end of the course.
Oh, 78-year-old male.
Next time on First Responders.
Whenever we go to a quad bike rollover, little alarm bells always go off because they normally never go well.
Intensive care paramedics prepare for the worst after a farm accident.
Anyone get that last radio call?
Status 1? Yeah.
Our patient?
Yeah, that's what they're saying. Confirming a blood is required.
I just felt so sorry for him, every single bump. I was hoping that he wouldn't feel them too much, but as that ketamine wears off, pain definitely comes back again.
A motocross rider with a badly broken leg endures the ride from hell.
Do you reckon you could bear through it just a bit longer?
Well, I need to.
Yeah.
I mean, there's bones just in your bones.
And a child suffers a potentially life-threatening allergic reaction.
This patient is young, and that's an even greater risk. They've got bigger problems like smaller airways which close very quickly, so we really need to be getting to the scene as quick as we can.